Hi, my name's Emma. I'm 32 years old and I have rheumatoid arthritis. I've been asked to tell you a little bit about what it's like living with it and how my diagnosis came about. I first noticed symptoms in November of 2012, and it started out, the main one was I woke up one day and I couldn't move my upper right arm. From the shoulder right down to the elbow, just didn't move. It was like somebody had switched it off. I could move my hand, but I just couldn't lift my arm at all. I get injuries like this a lot. I'm double jointed. I'm always throwing it out. Didn't think much of it. Called the physiotherapist and started to get it mobilised again. Over the next 2 weeks, I started to get pain in a lot of other joints, my elbows, my knees, my hips, my ankles, and as well as the weakness in my arms. And then I started to notice swelling in what's called the metacarpal joints, which are these ones here, and in the corresponding joints in my feet, the metatarsal joints. And these would go hot, red, swollen, very, very tender to touch. I'm a qualified podiatrist, so I know the symptoms of arthritis, specifically the inflammatories, and I realised that this wasn't right. And along with my physiotherapist and one of my colleagues, we all felt this just wasn't sitting right. So I made an appointment to see my GP, presented what the symptoms were, and straight away my GP referred me for blood tests. I had about 10 different blood tests done in all, checking things like my inflammatory factors and for a thing called rheumatoid factor. Within a couple of weeks I had my blood test results back and they were positive for rheumatoid arthritis, albeit my GP couldn't tell me that. So he referred me on to a rheumatologist, and I was seen again within another couple of weeks, and they carried out more blood tests and x-rays of my hands, feet and chest, and confirmed that I had rheumatoid factor positive rheumatoid arthritis, and I had a severely aggressive form of the disease. I was straight away started on a group of drugs called DMARDs, disease modifying anti-rheumatic drugs, and this was a form of chemotherapy initially called methotrexate. It comes with a 26-page book of side effects, of which I got none of them, but I did get hiccups every 20 to 30 minutes, and I also developed aphasia, which is where you put your words in the wrong place. So I would say like chicken instead of tomorrow, and didn't realise I'd done it. After about 4.5 months on those, the rheumatologist didn't like the way that my body was reacting, so removed me from them and gave me a few weeks without, which were not fun, and then put me on another DMARD called sulfasalazine, which, despite being incredibly safe and even safe for pregnant women, I had a very severe allergic reaction to. I lost most of my immune system. I went bright red and purple, and I was actually placed in isolation for a time as well. Fortunately, it didn't progress to anaphylactic shock. This is very, very rare, very rare. So I've now had 5 months without drugs due to NHS waiting lists, which is not normal for my area, but there's an awful lot of other people that are in bad way at the moment, so I've had to wait. Those have been some of the worst months of my life. They have been excruciatingly painful for me. I wake up in the morning and I want to vomit with pain sometimes because of the pain that's coursing through me. I spend about an hour trying to get up in the morning. You get severe fatigue with this disease. The constant inflammation, it gnaws at you, and it's like you wake up and there's an elephant sitting on you in the morning. It's not easy at all. I'm now on a new drug. It's not looking good on this one either. I'm apparently very special. Not a good thing with rheumatoid arthritis. I'm special enough as it is. If this doesn't work, I'll be going on to a drug called a biologic, and I'm going to have to inject myself every couple of weeks. So we'll see how that goes. I'm very fortunate these drugs are available, so I'm grateful for them. But right now I'll do anything to stop the pain. It is very, very bad pain. It normally starts first thing in the morning. It will last for maybe an hour and a half, maybe an hour. Some days it lasts all day. And then it will go on the evening, it comes back again. I get inflammation in my hands, in my feet. My knees are particularly bad at the moment. I've seen my fingers go 3 times the size that they should be. I've seen I had to take my wedding rings off because they might cut off the circulation. This has quite a big effect on your your daily life. There's days I can't do my job properly, so I can't do it. There are days when my memory is bad because of my fatigue. I've had to get a battery operated toothbrush because I can't brush my own teeth. I can't dress myself properly. Some days things like fastening a bra doesn't work. Some nights I can't unfasten it. It affects every aspect of your life. I have to squeeze my shampoo out between my thighs. That's how difficult it is some days because I just can't grip. When the pain goes bad, this happens, and your hands actually spasm up with pain. You can't feed yourself. You can't bathe yourself. Going to the bathroom is difficult. God forbid you get an itch. You can't scratch yourself either. But you learn how to deal with it. You put your pain in a little box. You put that box on a shelf in your head. And you deal with it. Because otherwise you'd probably go nuts. I've had to get a lot of gadgets. There's a lot out there. Thank you very much, physiotherapists and OTs and other people with rheumatoid for inventing these things. I think I've almost got every gadget going now. I've even got mobility wheels in my bathroom because I can't get in and out the bath without them and something to hold on to. I love my Culinaire one-touch can opener. Can't survive without it. But it's difficult for people to understand. I can hold things. I can do my job some days fine. And then you try and shake my hand and it hurts. Just because you're gripping in here. Other things I do, don't grip there. It's fine. But to shake my hand hurts. So I can drive a car at night, but I can't pump petrol. And that's quite difficult to understand unless you've got the disease. But it's difficult as well because people look at you and they go, but you're too young. You can't have something like that, or you don't look disabled, or you don't look sick. Well, I am sick. Sorry, I don't look sick. But it's not easy for me, and I'm trying my best. And hopefully there'll be a lot more people aware of the things that can go wrong. So hopefully you're watching this just for information and you don't have rheumatoid arthritis. But if you do, there is help out there. And if you don't, please maybe just think about it in a way that it helps other people around you that do.